I'd like to talk to you about laparoscopic suturing. Laparoscopic surgeons often avoid suturing laparoscopically, and that's for a variety of reasons, but in common with the open surgical procedures, we're going to teach you how to suture with a curved needle. It's important that you have the correct equipment for this, including needle holders and graspers. Initially, taking the suture from the packet is important, and if you remove this at right angles with about 5 millimeters of thread held back from the swage of the needle, you will find that on the introduction of this needle into the abdominal cavity, it's in a red position where you can utilize it immediately. This video clip just shows that, where on opening the packet, yourself or your scrub nurse can take the thread, the suture, 5 millimeters back from the swage, and because of the memory that exists in the suture material itself, the suture will sit at 90 degrees from the needle holder, allowing you to use this immediately on entering the abdominal cavity. The next step, once you do introduce the needle into the simulator or the abdominal cavity, is that the needle holder holds the tail 5 millimeters back from the swage. You also use a grasper on the distal tip of the needle, allowing you to manipulate the needle in many different planes and directions, as demonstrated here in this video. This then allows you to position the needle in such a way that the needle holder can let go of the suture itself and then take the proximal 1/3 of the needle before driving it through tissue. You should learn and practice this maneuver many times so that you become familiar with positioning the needle correctly in the needle holder. When driving the needle through tissue, you utilize supination and pronation of your wrist, and the following exercises will assist you in doing that. With the LaparTrain suture module, you can use the large open fenestration to drive the needle through the curve, through the hole, grasp it on the other side, and repeat this exercise utilizing supination and pronation of your wrist. In the next exercise, we're going to use the smaller holes on the jig, allowing you to pass the suture with increasing accuracy through these holes, as demonstrated here. When you become comfortable with those exercises, you are now ready to drive the needle through the tissue and the simulated tissue on the training jigs. It's important to steady the tissue as you do drive the needles through. Try not to completely remove the needle from the tissue, but once it's almost completely through, stop and retake it with the needle holder again in a position that's ready to take. This results in a greater economy of movement, and it will mean that you do have less needle manipulation to perform. Again here, this demonstrates that you steady the tissue with your grasper, take it with the grasper, steady the tissue again with the needle holder, And again, it should be in a position that's ready to utilize and grasp straight away, because the needle should be held in the correct plane. You can then pull the thread through the tissue. When we're performing intracorporeal suturing, we use the principle of C's. In this demonstration, the grasper will pass the needle back to the needle holder and form a C loop, as demonstrated here. This is your first C. The next step, you will wrap the needle around your grasper to form the first 2 throws. As you become familiar with this technique, you'll usually find both instruments working together, but initially holding one instrument steady is the way to go. Once you have thrown the first 2 throws, you can then tension or snug down onto the tissue. Again, by taking the thread short, you get a better grip and you do not lose sight of the needle. You now create a reverse C by passing from the needle holder back over to your grasper and wrapping again. For demonstration purposes, we've done double throws. But if you were tying an intracorporeal surgeon's knot, you would do an initial first 2 throws and then in an opposite direction throw a single throw to create your surgeon's knot. But as I said, for practice and demonstration, we're using double throws. And you can see here the direction of both sets of throws will result in a locking knot or a square knot. And again, for practice and demonstration, we're going to throw 2 more in the opposite direction. So here the needle holder takes the thread from the grasper to create another C, as is clearly demonstrated here, and the suture is wrapped again.